Hello, welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley, and wow, yeah, we got an absolute wonderful show coming your way today. So, this is what I'm gonna tell you. I'm gonna give you a heads up. I think everybody needs to sit back, grab you about 9 to 10 bags of popcorn, sit back, listen up, because we got some absolutely fantastic guests on the show today. We also got the guest co-host, Dr. Michael Mantell. I mean, this is 306 degrees of F on Wednesday. And we got an extremely, very, very, very special guest coming your way. Uh, how you doing, Dr. Mike? How you doing today?
I'm doing great. You two are my faves. And if it's Wednesday at noon, it's 360-degree health. And you're right. We have an incredible guest today. Certainly a leader, a visionary. And we're going to be just talking a little bit about, not a little, we're going to be talking quite a bit about how to leverage your workplace to support your overall health and well-being. It's an interesting topic.
I'm excited about that. But Doc, we can't do anything unless we bring the executive producer, the boss, and the co-host on to talk about the show. Also introduce our great guests, and talk a little bit about us. So how you doing, Michelle? How you doing today?
I'm doing good. Doing really good. Busy day, but I'm doing well. I'm excited about the guests as well. I'm excited by the time we have these 360-degree health series. We got some amazing topics and guests who just really educate us.
Yeah, so Michelle, I'm excited. I want to hurry up and get to this guest. So whichever platform that you're watching us on, whether you're watching us on E360 Television, Transfer TV, YouTube, LinkedIn, Twitter, whatever, you want to be part of the conversation, all you have to do is go to the comments on the platform that you're watching us on. Ask any question that you might have. I promise you we'll get you an answer. Michelle, please introduce the title of the show, purpose of the show, and introduce this absolutely wonderful guest that we have.
Yes, well, today's show is 360-degree health. Well-being is a team sport. How to leverage the workplace to support your health and well-being. And Dr. James J.C. Cooley and guest co-host Dr. Michael Mantell will have a discussion with Dr. Richard Safir. He's the Chief Medical Director of Employee Health and Well-being at Johns Hopkins Medicine. We're going to talk about workplace relationships that impact our health and well-being from a co-worker's perspective, from a team norms perspective, from a manager, team leader's perspective, and basically how the workday itself impacts our health and well-being and little steps we can take to move forward that don't require an hour off of going to the gym. So Dr. Richard Safir earned his BS in nutritional biochemistry at Cornell University under the tutelage of T. Colin Campbell, author of the China Study, before attending medical school at State University of New York at Buffalo. Dr. Safir is the Chief Medical Director of Employee Health and Wellbeing at Johns Hopkins Medicine, where he leads the Healthy at Hopkins Employee Health and Wellbeing Strategy. He also holds faculty appointments in the School of Medicine and Public Health at Johns Hopkins University. Before arriving at Hopkins, Dr. Safir practiced family medicine in Northern Virginia. He was then on faculty at the George Washington University, serving as the residency director of family medicine in his last year at the institution. He was the medical director of Occupational Health Center in Baltimore and wellness director for the Mid-Atlantic region of the parent company just before starting at Care First Blue Cross Blue Shield in Baltimore, Maryland, as the medical director of preventive medicine. I can go on and on about this amazing guest, but it'll take me the whole show. So please welcome Dr. Richard Safir to the show.
Thank you. Thank you,
Wow.
Michelle. Thank you, everybody.
Wow, great to have you here. I'm sure that our listeners, our viewers are saying, wow, this is a superstar, a rock star in health and well-being in the workplace. So, Rich, thank you for taking time to be with us.
A pleasure to be here with both of you. And I feel the same way about both of you. JC, thank you for your service to the country. You put yourself in harm's way to give me and my family the opportunity to enjoy the independence that and freedoms that we have here in the U.S. So I appreciate that.
Really appreciate you taking the time to come on the show. Dr. Rich, for our listeners that they've listened to some of the stuff that Michelle was saying, can you tell them a little bit more about you, where you grew up, how you got into the medical field, and what made you click?
Sure. Yeah, let's do the things that you can't find on a Google search, because if people want to learn about me, they can. I grew up in a suburb of Buffalo, New York, and I'm the youngest of four kids, and played outside a lot. We didn't have cell phones then, and we didn't have as many processed foods. So I don't know. I felt like I had a pretty good upbringing, and somewhere along the way, I realized, hey, I'm pretty interested in the life sciences. And when I started studying biology in college, it was all about plants and earthworms, and I'm like, this maybe isn't so exciting. And then I found a path to study nutritional sciences, and that was a blessing because not only did I learn before going to medical school about our own health, it also taught me about other areas of prevention and other areas of how we can stay healthy. And so, after finishing medical school and starting to practice family medicine, I slowly but surely moved toward this idea that, hey, our patients, they only spend 15 minutes with us in the examination room, but they spend almost 2,000 hours in the workplace each year. That's where we need to be making a big difference. And I found myself now in a great situation to help 40,000 healthcare workers who are committed to serving our community.
You mentioned the 40,000 healthcare workers. Our audience may not be aware, though certainly those of us in the healthcare arena are too aware, I guess, of burnout in healthcare providers and
Yeah.
practitioners. Talk a little bit about the burnout amongst people in healthcare, physicians, nurses, and related healthcare areas.
Thank you for bringing this up, Michael. Before I even let's go that direction. Next time you see a nurse or a nurse assistant, a medical assistant, a phlebotomist, your doctor, just say thank you. Let me tell you, they are working really hard. Now, the burnout issue, when the physicians, the nurses have become exhausted and they're no longer deriving pleasure from their work, is real. It's gotten worse in the last few years. But the problem started probably a couple of decades ago. There's an inordinate amount of work that goes on behind the scenes that you don't see as a patient. A lot of it is administrative work, and that's not what most doctors and nurses signed up for. They want to deliver the care. But unfortunately, the complicated healthcare system in which we now work has dictated some additional tasks. Michael, that topic, burnout alone, could be a whole show. I'm just going
Right.
to leave it at that unless there's a specific question, but there's plenty of other things we can discuss.
Well, let's talk about those other things that we
Yep,
can
sure.
discuss. There are many changes that employees and employers can make to help transform their workplace into a space that nurtures health.
Hmm.
We're going to talk about some of those. But why would let me say this, the average employee thinks about all kinds of problems at work, and this is
Yeah,
too much, and the hours and the stress, and
yeah,
I'm being lied to, I'm not being
yeah.
supported. Why? Tell us why we ought to be concerned about the impact that other employees and the workplace in general has on our health and well-being.
Well, I mentioned one of the reasons we spend almost 2,000 hours a year working, and it's where we spend most of our waking hours each day on the days that we have work. It's not like we spend more hours awake at home. And so there's a huge amount of time that we spend with our coworkers and our place of employment. So if we don't take advantage of that time, if we don't take advantage of the people that we work with, then we're really missing out on an opportunity. And looking the other way, Michael, if we allow our jobs and our workday to negatively impact ourselves so much that we take it home with us,
Hmm.
then we're really doing ourselves a disservice because we're suffering outside of work, and that's not helpful.
I know that we weren't going to necessarily talk about your book, but I just want to just hold up the cover. And this is the book that Richard wrote, A Cure for the Common Company, and how, a well-being prescription for a happier, healthier, and more resilient workforce. We all want to be healthier.
Yeah.
What are some things that we can do to begin to turn our workforce and our workplace around?
Very big question. I'm going to try to just kind of parse out like what we already know and what we don't know. So most people know that we shouldn't smoke, and most people know we need to eat more apples and take more steps. So telling our employees to do that is probably not the best use of our time and energy. What we're not taking advantage of in the workplace are a few big things. One big thing is relationships, and the other big thing is let's call them environmental factors like nudges or behavioral economics. And so maybe we're going to explore the different types of relationships in the workplace, because there are several different forces in that category.
You talk about, I think, 4 different kinds of relationships in the workplace. Am I correct?
Well, I don't number them necessarily, but
Okay.
I can look at it as 4 relationships. Let me just look at I said something about not smoking. Well, most people know, hey, this is bad for me. And
Right.
most employers who care about their employees are giving their employees an opportunity to get like a nicotine patch or a prescription pill, things that they could help the individual. But did you know that when our employees try to our employees when we, if we're a smoker, try to quit, and we quit with a coworker who's also addicted, we're almost twice as likely to succeed. So what are employers doing to help friends quit together? Because frankly, a lot of people who smoke are friends with someone who smokes. So we need to be
Dr.
thinking
Rich,
about
hold that thought, because
Yeah.
we got to take a station break.
Oh,
And I don't want to lose none of this right here.
okay.
So we're going to take a station break. If you want to be part of the conversation, whichever platform that you're watching this on, all you have to do is just go to the comments, ask any questions that you might have. I promise you, we'll get you an answer. Is your life. We'll be back shortly after the break.
I never wanna leave. Yeah, I'm right where I wanna be. We got something you and me, and I can't get rid of this feeling. Just like a magnet, we're just like a magnet. The things we have can't be taken for granted. Now I know that it has always been you. I can't help it, I'm so drawn to you. Just like a magnet, we're just like a magnet. The things we have can't be taken for granted. Now I know that it has always been you. I can't help it, I'm so drawn to you. Hey, I'm so drawn to you. I'm so drawn to you. Yeah, yeah.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? And everything that you do.
Hello, welcome back to the James Cooley Show. It's your life, and I tell you, I had to cut Dr. Rich off, really, because he was getting ready to put out some nuggets, and I know that the station break was coming up real soon. And Dr. Mike, I did not want to miss any of that, So
That's why I didn't cut into it. I didn't say, I saw the break coming, but I figured we want to hear this. So let's come back to it, though, Rich. You were
let's
talking
come back to it.
Sure. No, JC, I felt the excitement coming on inside of me. But I realized during the break that we don't have a ton of people who smoke anymore, thank goodness. But we do have a lot of people who want to try to move more. And so I'll use that example of moving during the workday. Now, a lot of people who are employed sit most of the day, and it can be challenging to get enough steps in to keep your heart healthy. So, using the same idea, what we're talking about is peer support. When we have a friend or a coworker who is also interested in building the same healthy habit or getting rid of the same unhealthy habit. Can you find a coworker, a colleague, a friend at work that can share that with you? Because we know that when someone else exhibits or practices that behavior together with us, we're more likely to take that next step. Yes, that was an intentional pun, and build that healthy habit.
think about a workplace that supports peer support.
Yes.
That's a healthy workplace.
Yes.
Unfortunately, I think not enough workplaces have directors of well-being with a background such as yourself, and many workplaces just ignore, they neglect the well-being of employees to the detriment of the workplace and the worker. Increased absenteeism, reduced satisfaction in the job, decreased morale, and increased mental health issues, high attrition, reduced performance. The list goes on.
Yeah.
If I work in a workplace that doesn't support this, that doesn't have someone at the top who is pulling for well-being, what can I do as an employee? How can I bring it to my employer?
Well, I do think it needs to work both ways. We do need to be responsible for our own well-being during the workday, and hopefully some of the things I'll share with our audience today will be helpful. And if we are comfortable, we could start our own, let's say, grassroots effort. It is true that it would be nice if the employer had the resources to do everything possible, but most employers don't have the resources to do everything possible. We have to understand that there's a reality at play. So, short of walking into the president's office and educating them about the benefits of creating a healthy workforce, I would say, right now, Michael, sticking with this idea of peer support, find yourself a coworker who is also looking to build the same healthy habits and figure out a plan together. Are you going to walk during lunchtime together? Are you going to both stand at your desks during virtual meetings and you're there chatting with each other? Hey, you standing? Yeah, I'm standing. You standing? Yes. What will it take for you to find and work with a partner to hold each other accountable?
So the quality of communication, collaborating with coworkers and others and maybe other departments really does contribute to our overall well-being. We know there's a lot written about social health
Yes.
and the importance of that for our happiness.
Yeah.
Can you talk about some examples that you've brought to organizations where that's been of value?
Well, social connectedness. Yeah. So I'm going to talk about another type of relationship as we answer this question. Like, hey, can you give us some examples? So, um, norms are the collective behavior of a group. It's what's expected and accepted. And so most people work on a team. And so you have more than just one peer. you've got a collection of people who all report to the same manager. And so that team relationship and those norms will greatly impact your health and well-being. So if everybody on your team takes a lunch break, guess what? You are probably going to take a lunch break. And if the norm is to keep working through lunch and you've only been there for 3 weeks, you're probably not going to take a lunch break because you're going to think, "Oh my god, my new boss, they're going to think I'm goofing off." Norms are powerful. And so I'll give you an example. We have a lot of resources at Johns Hopkins to help support the health and well-being of our workforce, but I don't think that's what makes what we're doing special. What I think makes us special is that we use some of these social sciences to increase the likelihood that things are going to stick. So when we offer a program, we offer it to a team. So we'll go in and say to the managers, "Hey, we can do this for your team together, and you need to be there as the team leader." And if you are there, they will show up and they will know that this is important to you. And then they will have this experience together and normalize the process. That's what makes it more likely for us to engage in healthy behaviors.
Hey,
My
Rich,
focus is in psych. I'm sorry, JC. Go ahead.
no. You mentioned something that's kind of stuck. The culture of an environment.
Yes.
The culture of environment has a negative or a positive effect
Yes.
on the employees. Everybody around. So in what ways would you say the culture of an organization affect the mental and the emotional of its employees? And how can a positive culture be cultivated into where everybody understands
Mhm.
their role, they're willing to give 110%,
Right.
and just be willing to support the organization?
So, a culture is the shared behaviors, beliefs, and attitudes of a group of people. And so, in this case, we're talking about the group of people who work together. And so, there's a team culture, and there's also a greater organizational culture. And it's not reasonable to think that an employer is going to be able to create, let's say, 1,000 custom wellness plans if there's 1,000 employees who work there. But it is reasonable to think that an employer will be intentional on creating this supportive workplace culture so that employees can be supported on whatever health and well-being path they're taking. And so part of that is about let's start with, there's so many choices to pull from. Let's start with keeping our emotions in check. All right. So many people get stressed during the workday. And I'll tell you, for myself, one quick way for me to lower my stress level is to take a deep breath or do one of the breathing patterns. When I say one of the breathing patterns, we offer a variety of breathing patterns to teach to teams. Okay. So think about this. We just talked about norms and we just acknowledged that work is a stressful place. Now, I don't think people are going to start doing a breathing exercise in the middle of like people sitting around because they're going to be looking at them like, what is that person doing? But if we teach a team of employees to do this, then all of a sudden it's become a normal behavior. And it's almost like we're giving them permission to do something that they haven't previously done. And so by doing this, it's great if one person is less stressed, JC, but wouldn't it be even better if a whole team is less stressed?
You mentioned you've been talking about peer support. Now, a lot of the work that I do in the mental health end of things, I talk with people who don't feel comfortable. They don't feel included. They feel excluded for a variety of reasons, much of which is imagined, but sometimes it's not. How do you approach those people who are the outsiders?
So, Michael, I'm glad that you mentioned that much of this not feeling included is imagined, but some of it is concrete. I don't coach individuals, although I do speak with some of our managers when they're having a well-being challenge for their team because I want to understand what's happening so that when I go to the team, I have a better sense of what I can do to support them. Michael, the idea of inclusion, like so many other well-being and health issues, is not like a light switch on and off. It's more like a what is that? A dimmer. There's variations, and what we need to understand is that we need to create opportunities for people to feel included. And what does that look like? I mean, it could be like the proverbial, oh, we're having we're going to have coffee hour now. I mean, that's kind of a forced way to say, come, you're socializing. But there are much more subtle ways that we can weave through the day. So even just the manager sharing with the team or that one person who they suspect is not feeling included, something personal about themselves that they're comfortable sharing. When we start to share personal stories about ourselves, especially the painful ones, we show that we're vulnerable. And when we're vulnerable, it makes it easier for other people to relate to us because let's face it, we all have our challenges. And so if you're the person who's not feeling included and you hear someone who's part of the in-group saying, hey, this isn't working for me, that's almost like a blanket and a cup of warm cocoa saying, hey, it's going to be okay. That person's also having challenges. And if we do this enough, it's likely that the person who's not feeling included will start to open up because they realize other people are opening up. This could be a norm, Michael, if the team leader is intentional on creating the opportunities for people to share.
How important is that one-on-one coaching in terms of building a healthier culture?
Yeah. Well, there's different types of coaching, right? I mean, some companies offer like a well-being coach to work with you on your nutrition, and that's great if you can do that.
Yeah.
However, the relationship we have the greatest opportunity to leverage the power of coaching is between the team manager and the employee. Now, I don't think it's reasonable to expect our managers to be trained in their area of expertise and to be the world's best coaches.
No, I don't think so.
But I do expect, and there is an opportunity for organizations to help their team leaders learn how to better support the health and well-being of the people they lead. And Michael, I try not to run on with my questions, but I just got to go another minute here. We have created 5 different training programs for leaders at all different levels of the organization at Johns Hopkins Medicine. Some of them are 10 minutes. Some of them are an hour. Some are virtual. Some are in person. Some are mandatory, and some are voluntary. You can, if you Google me, you can learn more about them. And I hope you will. This is important for managers.
I know I do something for a company we call 1 minute wellness, and just literally 60 seconds of a little tip on how to think differently.
So we created 10-minute well-being tips for managers because managers are busy. So we said they can take 10 minutes. We delivered them live, but we also recorded them.
We got to take a station break. I don't want to. I don't want to. But
okay, you're keeping us on task.
This is so interesting, and I tell you what, I know that you all enjoy. I'm looking at the numbers here. The numbers are off the chain, meaning we got a lot of people watching and listening and giving us the thumbs up and said, "Oh, keep it coming." If you got any questions that you might have for Rich or Mike or myself, all you have to do is just go to the comments, ask any questions that you might have. I promise you, we'll get you an answer. It's your life. We'll see you shortly after the break. Hello, welcome back to the James Cooley Show. It's your life, and I got I always every Wednesday I got Dr. Michael Mantell, 306 degrees of health, and he always identifies such top-notch professionals to come on and just educate us and help us out, and also enlighten us on certain things that we might not clearly understand. Sometimes we don't know anything about it, And we got the fantastic Dr. Richard Safir, John Hopkins University, one of the top universities in the not just in the United States of America, but the world. I'm talking world here, sharing his ideas and his thoughts with us. And it's an absolute pleasure having you on, sir. The conversation that we have already touched upon, and we can really touch upon a lot more. So our audience out there, I see the numbers, and they are enjoying this as well. So hey, one thing I want to touch on in the beginning of this, Dr. Mantell, can you hold up a copy of his book? I know that's not the main issue today, but a cure for the common company. And this is what this great man is talking about. And I want to just touch bases with a little bit about this book, because Michelle and I did some of our research. We haven't had an opportunity to read the whole book or any of this, but uh, Rich, can you tell our viewers and our listeners why you wrote the book, what the book is about, and how that's going to help formulate a more resilient workforce and workplace?
Sure. I've been in the field for about 25 years, and probably for the past decade, I realized, we can't create a healthy and well workforce just by having folks like me and the team that I work with. We actually need everyone to be involved, because our health and well-being depends on the people that we work with. And so that was probably the biggest reason, because I need leaders and human resource professionals and anybody who impacts the health and well-being of those around each other to be part of the solution. Now, there's a lot of self-help books out there, but very few that talk about how we can stay healthy and help others be healthy during the workday. JC, resilience is kind of complicated. There's a lot of different ingredients, but part of it is feeling socially connected and supported in the workplace. Part of it is getting a good night's sleep. Part of it is having friends. Part of it is feeling well. And so these things all add up. And the book is a formula. It's, hey, if you follow these steps, you will have a happier, healthier, and more well day. And over time, this builds your resilience so that when something bad happens at work, you bounce back more quickly.
Rich, the average person probably doesn't have the resources that Johns Hopkins has to bring someone of your caliber in. So how can we identify whether our workplace is promoting our well-being and our health and happiness or not? Now, I know that we can tell, I don't like the workplace, my boss,
Yeah.
but what are some of the hallmarks that we ought to be looking at?
Well, I mean, everybody's got their own impression as to whether or not their workplace supports their own health and well-being. If your organization wants a little bit more objective perspective,
Yeah.
there are organizational assessment tools that the organization can fill out. They're basically long checklists of, are you doing this? Do you have that? And you'll find where there are resources, and you'll find out where things are lacking. So that's an option. Michael, I think one of the best ways for an employer to understand what's working and what's not working is to do an employee assessment. Get your employees, give your employees an opportunity to give feedback, and when you do, make sure it's anonymous. Because if it's not anonymous, there's a very low chance that people will respond, and if they do respond, that they'll be candid. You really want to be able to be candid.
You shared before we went on some of your experiences way back in the 90s with a sports team
Oh,
where
yeah.
you began bringing some of this to people that we would think never would be open to this. Can you talk a little bit about that?
Sure. Now, I didn't bring this. What I'm about to share, not me personally, but what I found very interesting in the '90s, which I learned and I use it to this day, is this
Yeah.
idea that in the '90s, the Chicago Bulls, for anyone who watches basketball, they were out of this world. One of the best basketball teams of any decade. They won 6 NBA championship titles during that decade, and their coach Phil Jackson, he brought the practice of mindfulness to the team. Now, imagine this 30 years ago, before mindfulness was a common discussion, he brought mindfulness to these big, strong athletes with big egos. Can you imagine the conversation that went on in there? Now, it's important for basketball players to be mindful, any athlete, because we know that when we're mindful, we can focus better. And when we can focus, we're not going to miss the ball when someone passes it to us. Now, fast forward to 2024. At Johns Hopkins Medicine, we have a certified mindfulness professional in our Office of Wellbeing. That was not an accident. Years ago, we identified the need and made the business case. It's important that employees, both for their own well-being, learn the art and science of mindfulness, but it's also important for an organization. That alone is another show.
Right.
I'll tell you, Michael, it's interesting how what we learned 30 years ago can make a huge difference in our lifetime.
It is amazing. It's really true. And you think about people at that caliber, at that level of performance, who benefit from mindfulness, from awareness.
Yes.
What my mother used to say, Michael, pay attention. Today we call mindfulness, but we get the idea. How important is the notion of everyone, all senior management, to be a part of it? What do you do when you have someone who looks askance, who thinks this is all nonsense? Just get to work.
Yeah.
How do you handle those people?
Well, the more people who are involved with being part of the solution, the more quickly the solution will come and the more effective the solution will be. And whether it's a new product that's being built or a mindfulness program, you're always going to have a naysayer.
Right.
So, Michael, personally, I don't like to get into arguments. It's not good for my own well-being. I try to diffuse any disagreements if we're in a group, and then later on, I'll speak to that person individually. But really, for my own well-being, what I like to do is embrace and support those people who are ready to move forward, and sure enough, the people who are the naysayers, they eventually come along. I subscribe to the diffusion of innovation. It's a behavior. It's like an organizational behavior model
Yeah.
amongst some other organizational change models. But my point being, Michael, you're always going to have a naysayer. There are ways to deal with it. I'm glad you brought it up. And if you're interested as a listener, you should look up that diffusion of innovation model and also check your own well-being. Don't let the naysayers get to you.
Now, back in 1980, I created a program of psychological services for the San Diego Police Department and a dozen other departments. They didn't have it.
Yeah.
And the idea, this was well-being before we were talking about it. And I was bringing all kinds of, programs to law enforcement officers. One day, I realized I was leaving out their families.
Mm.
Same thing at one of the local hospitals. I was doing a physician wellness program, and I forgot. I thought, wait a minute, I'm forgetting the family. Does your program include spouses, partners, opportunities for families to get to benefit from the well-being services that you offer?
You know, we when we go to work, we bring our families. Maybe not physically, but they're always there with us, and it's important for each of us to know that, because if you see a coworker having a bad day, it may not be something that's happening at work. It may be something happening at home. So, Michael, we do have some resources for the people at home. But because what you said is so important, I include a little call out box in many of the chapters called There's No Place Like Home.
Right.
And I do that because I think it's important for each of us to learn how we can optimize our health and well-being and that inner space between our work and our home. Michael, programs and resources are good, but as individuals, it's even more important that we understand these dynamics and figure out how to best navigate those challenges.
Such a key message that you deliver is that typically the individual will blame him or herself for their physical health or mental health issues. And what you're saying is open your eyes. There's an interaction, there's a connection to your workplace and your coworkers that impact you as well. As a physician, I know that lifestyle medicine and the 6 pillars of lifestyle medicine are important. We've had people from the American College of Lifestyle Medicine here. Can you talk a little bit about how you bring the pillars of lifestyle medicine into play in your well-being program?
Well, I want you to hold that thought.
There we go again.
I have to pay the bills. I have to pay the bills. But Mike, can you ask that question as soon as we come back on the break?
If I can remember it.
I got it. I took notes.
I tell you, this is such amazing. And I think you guys heard what Rich said. He said, well, that's another show. I think he did say that. That means that he might agree to. I'm not going to put him on the spot. But I tell you, this is such a engaging and such a wonderful conversation that we are having with these 2 great docs. And I tell you, if you want to be part of this conversation, all I got to do is go to the comments. Ask any question that you might have. I promise you we'll get you an answer. It's your life. And we'll see you shortly after the break.
I've seen a smile convey I love you. I'm proud of who you are. The one that keeps us close when we're apart. Walking from the darkness of all that we've been through. It seems that there might be a way to leave behind the loneliness we've known. Live again, life of
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
Hello, welcome back to James Cooley Show. It's your life, and I tell you, um, this is I mentioned earlier about before the show even started to grab you 10 bags of popcorn. If you was at the movie theaters and you taking in all of this, you probably like, why did you didn't tell me get 20? Yeah,
You know,
because
JC, popcorn is my go-to afternoon snack, actually, and I was thrilled. I actually noted that when you introduced the show.
it just it's so exciting, so much information that you all are sharing with our viewers and our listeners and our audience. And I think even the doctors ourselves, we all are learning from each other. I mean, at least I am learning from you guys. So it's just an absolute pleasure having this team right here to discuss this topic because, uh, Rich, I'm a leadership guy. I don't know if you know that or not. Uh,
Yes.
Organization leadership, transformation leadership guy, and I believe that the leadership start from top down, also from bottom up. Everybody opinion counts. Everybody in the organization is special. Everybody have this thing called purpose. Purpose. With that being said, I know Dr. Mike, we're gonna get back to your question, but I don't want to let it get away with your last chapter in your book called Purpose. So I'm just gonna put that in there. I'm gonna turn it back over to Dr. Mike, but I want to touch bases on that when we get an opportunity. We got about 8 minutes in the show.
Talking about purpose, I think that the purpose that most people, probably close to all people in healthcare, one way or another, have a purpose, a calling to help others, to lift others, to give people the tools to live optimally. One of the very contemporary lenses through which we look is from the American College of Lifestyle Medicine. You certainly, Johns Hopkins is certainly connected to that. In the employee well-being world, how important are the pillars of lifestyle medicine and talking about that and structuring a program for employee well-being?
So, for our audience, let's just first define lifestyle medicine is the use of non-pharmacological means like no drugs or surgery to not only prevent disease, but to treat disease. Now, Michael, I was involved with the American College of Lifestyle Medicine before it was an American College of Lifestyle Medicine.
I thought
And
so.
I was there at the first conference when there was only 50 people,
Amazing.
and it's grown. It's huge. 9,000 professionals now, and I'm happy to have been on the board at one point. So there are 6 lifestyle medicine pillars, and I don't want to be put on the spot to recite all of them, but let's just note that like nutrition, movement, sleep, so people get an idea. Now, we hold those behaviors very valuable at Johns Hopkins Medicine. And as I mentioned earlier in the show, most people know that they should sleep more and that they should move more and eat better. So we don't tell people that, but we
Right.
do offer them opportunities to make it easier. And one lifestyle medicine program that we focus on is around blood pressure. We call it Keep Your Pressure Down. And it's a play on both your blood pressure and the pressure from work. And it's a 9-week program. It's first of all, it's voluntary. If you want to sign up, you can sign up. You have to have either pre-hypertension or hypertension. It's a 9-week program, 2 sessions a week. We do it in a cohort, a group of people together. Remember, we learn from each other, we get support from each other, and we cover these different topics: sleep, movement, nutrition, the importance of being socially connected, the importance of decreasing our stress levels. Now, we don't cover one of the pillars of lifestyle medicine. We do not cover addictions to like
Right.
tobacco or alcohol. So we pretty much run the gamut. But what I really like about our program is that we leverage what we're doing within the workplace to support our classmates, our students outside of those 45-minute sessions. Let me give you an example. When we start the program, one thing we do is we ask people, if you signed up with someone, that's great. You now have a peer. If you haven't, find a peer within the group so you can support each other. When we do our steps challenge to encourage our employees to get more steps in, people sign up in teams. And we tell the folks who are in our KYPD program, sign up as a team. So you see us leveraging this. In our cafeterias, food that has low sodium has a green leaf on it. We tell our students in our KYPD program, when we're teaching them about nutrition, how to read a food label, hey, guess what? If you go to the hospital cafeteria, we make it easy for you. Look for the green leaf. So it is a dynamic, integrated solution to give our employees as much support as we possibly can over that 9 weeks, so that when we're done there, they can continue to leverage what's in the workplace to continue helping themselves.
That's fantastic. That really is seamless living.
We try.
Oh, it's clear. So let's ask a personal question.
Sure.
Tell me, what do you do during the workday that helps you live healthier and happier?
I do a lot, actually, and every year I seem to add one more thing. So my work day starts before work. I make sure I start in the morning with a healthy habit. I actually brew my coffee and I sit and I do my Wordle. And then I do 5 minutes to 10 minutes of meditation every morning. And then, only then, do I get ready for work and start my work day. Now, during my work day, I would say the thing that I'm pretty reliable is that every day I'm either figuring out which meeting I'm going to stand during or walk during. And if
Very
and
interesting.
in both of those, obviously, I need to have, like, it's a virtual meeting, and so I can have a headset. The other thing I do reliably is that I take breaths throughout the day. I've gotten so good about feeling my muscles tense and my neck. I don't know if that's a good thing or bad thing to tell the audience that the guy about well-being gets stressed, but that's the reality of life. But I've learned how to compensate, and I do my breathing exercises to lower the pressure.
And do you share this with your family?
Oh yeah, I think a little bit too much. I think they're done with me.
Rich,
You know,
we only have about a minute left, but what role does spirituality play in a life of well-being?
Well, I believe spirituality does. What I thought you were going to ask is about spirituality in the workplace, and
Ah,
there is a book by Jessica Grossmeyer. Anybody who wants to read more about it. I don't know. I mean, we're not there yet. We have chaplains within our facilities who are willing to support our employees, not just our patients. So we think that's a great asset, because that's comforting to some people. But I know that every employer has to make a decision about what they're comfortable with the set of employees that are within their community.
wow. We're out of time. However, this was amazing. And Rich, I hope that you can carve some more time in your schedule to get with Mike and I and come back on the show and talk about some more things, because I believe that this was so incredible to our viewers and our listeners. Certainly myself, Michelle, and I believe Mike as well. So I want to thank you so much for taking the time out your schedule. And you're invited back. If you got time, please let us know. We'll get you back on. I'd like to thank Dr. Mike. You already know I love you, bro. My brother, I love you. I'd like to thank Dr. Michelle Cooley for putting together another absolutely fantastic show. But most importantly, I'd like to thank our viewers and our listeners for tuning in to the James Cooley Show. It's your life, Monday through Friday, 12 p.m. Pacific Standard Time. Remember this. Always, always, always dream big, think big, and be big at everything you do. We'll be back tomorrow, same time, same place. It's your life.